New this morning, we are learning that a sailor who was cleared to return to duty aboard the San Diego-based USS Roosevelt has tested positive for coronavirus. The ship made headline when Captain Brett Crozier was relieved of duty after sounding the alarm about an outbreak. News 8's Chris Groh is live along the Embarcadero with more on what the Navy officials are saying about all this. But this is concerning here, Chris, because they thought that he tested negative, and then turns out he was positive here.
And he got back on the ship. And if you remember, that outbreak has essentially forced the Roosevelt to dock there in Guam and stay there out of service, not able to do its duties there. So what's going to happen, or what many thought would happen now that it appears someone with COVID-19 was on board the ship, is it actually may continue to go on. A lot of people may look at this headline and think another outbreak may happen and that this may force the Roosevelt to continue to be out of service. But according to a senior Navy official that spoke with CBS News, that official said that it's probably not possible to make the Roosevelt COVID-free, and that the ship will have to rely on masks, constant cleaning, and to the extent possible, social distancing to contain any outbreaks once it gets underway. Now, currently, at this time, all 4,800 crew members are not on the ship right now, but it may not wait for all of them to return before being cleared. Instead, they'll just wait for necessary sailors with the right skills and the right operation sections of the Roosevelt to return, and then that way they can go ahead, but with not all 4,800 sailors on board. Now, the Navy stopped providing updates on the status of cases. The last update was on April 30th. At that time, there were more than 1,100 active cases amongst those 4,800 sailors that were there on board. So again, it does appear, according to a senior Navy official, that the Roosevelt will proceed to trying to get back into service despite this recent contact that this person may have had and the exposure of those sailors on board to this most recent COVID-19 case.